Okay, today we're going to be draping a female's shoulder. Thank you for that. Okay, let me try again. Okay, today I'm going to be draping a female's shoulder. Here's our female patient. Thanks, Lindsay. Appreciate it. And the first thing I want to talk about is why we want to do some draping. First of all, I want to make sure it's culturally appropriate for the patient. In some cultures, showing some skin could be seen as not the best move and not good for their culture, so I want to make sure we do that. We also want to make sure it's age appropriate. If we have an older patient, want to be appropriate with them, but also even like me being an older male, if I had a younger female patient, that could be seen as not the best situation. Definitely want to talk to the parents, make sure if they feel more comfortable with having a loved one around, I can have those around. Want to protect their modesty, also want to make sure they keep their dignity intact. And then there's also, we want to make sure they keep warm, protect any type of wounds, protect their clothing, make sure they feel safe. And if I'm using any lotions or ointments or vanilla scented candles, just kidding, there'll be no candles today. But make sure nothing's getting on their clothes and making sure they're protected. The first thing I'm going to do is just take this sheet, and I'm actually just going to go all the way around you here. That way I'm kind of draping all over. I'm not really making it to where one just piece of skin is showing. I feel like that's best. Then when I come over to the shoulder, I'm going to come over here. I like to go from the inside. That way I'm actually trying to never touch the skin there. I'm going to roll that in. And then I'm also going to get the bra, if there's a bra, and bring that over too. Do you feel comfortable right there?
I do.
And I want to make sure that I'm anchoring this in all around so that, again, they feel safe, they feel secure. And I'm going to actually take one more towel here. Is your hair okay there?
Yes, thank you.
I'm going to take this, kind of probably just drape this over here, again, to protect, her decency. I don't need to see any skin that we don't need to do because I just want to frame the area that I'm going to be working on. So as you see, I can frame the area, I can work on the shoulder, and then when I'm done, since I used a towel here and I tucked it in, I can use the towel, wipe off any ointments I used, bring that up like that, take this one off here, and then go off like that. And I just also want to keep talking to her the entire time. And if I'm around her, always touching, making sure that she knows where I am around her body. So if I'm behind her, she isn't looking around wondering what I am, where I'm doing. And so that is how you drape a female shoulder.